What is Zithromax used for? If you're wondering about the potential benefits and risks of this popular medication, you're in the right place. Zithromax, also known by its generic name azithromycin, is a commonly prescribed antibiotic that is used to treat a wide range of infections. From respiratory tract infections and skin infections to sexually transmitted diseases and ear infections, Zithromax can be an effective treatment option for various conditions. Common conditions treated with Zithromax. Zithromax is used to treat a variety of bacterial infections. One of the most common conditions that Zithromax is prescribed for is respiratory tract infections. This can include infections such as bronchitis, pneumonia, and sinusitis. Zithromax works by targeting and killing the bacteria causing the infection, helping to alleviate symptoms and speed up recovery. In addition to respiratory tract infections, Zithromax is also effective in treating skin infections. This can include conditions such as cellulitis, impetigo, and folliculitis. Zithromax can help to clear up these infections by eliminating the bacteria responsible for the skin infection. Sexually transmitted diseases, STDs, can also be treated with Zithromax. Conditions such as chlamydia and gonorrhea can be effectively treated with this antibiotic. It is important to note that Zithromax may not be the first-line treatment for all STDs, and your healthcare provider will determine the most appropriate course of action based on your specific situation. Ear infections, particularly those caused by certain types of bacteria, can also be treated with Zithromax. This antibiotic can help to reduce inflammation and clear up the infection, providing relief from symptoms such as ear pain and discharge. While these are some of the most common conditions treated with Zithromax, it is important to remember that this antibiotic can be used for other infections as well. Your healthcare provider will determine the most appropriate treatment based on the specific condition you are facing. Dosing guidelines for Zithromax. The dosing guidelines for Zithromax can vary depending on the condition being treated and individual factors such as age, weight, and overall health. It is important to follow your healthcare provider's instructions carefully to ensure the proper and safe use of this medication. For respiratory tract infections, the typical dosing regimen for Zithromax is a once-daily dose for 3 to 5 days. The duration of treatment may vary depending on the severity of the infection and your healthcare provider's recommendation. When it comes to skin infections, the dosing guidelines for Zithromax may vary. In some cases, a single dose may be sufficient, while in other cases, a longer course of treatment may be necessary. It is important to follow your healthcare provider's instructions and complete the full course of treatment to ensure the infection is fully resolved. For the treatment of sexually transmitted diseases, the dosing regimen for Zithromax may also vary. Your healthcare provider will determine the appropriate dosage and duration of treatment based on the specific STD being treated. When it comes to ear infections, the dosing guidelines for Zithromax are typically once daily for 3 days. This course of treatment is often effective in clearing up the infection and relieving symptoms. It is important to note that these are general dosing guidelines and may not apply to everyone. Your healthcare provider will determine the most appropriate dosage and duration of treatment based on your specific condition and individual factors. Potential side effects of Zithromax. As with any medication, Zithromax does come with potential side effects. However, it's crucial to remember that not everyone will experience these side effects, and they are typically mild and temporary. Some of the common side effects of Zithromax may include nausea, diarrhea, abdominal pain, and vomiting. These side effects are generally mild and go away on their own as your body adjusts to the medication. If these side effects persist or worsen, it is important to contact your healthcare provider. In rare cases, Zithromax may cause more serious side effects. These can include allergic reactions, liver problems, and irregular heart rhythms. It is important to seek medical attention immediately if you experience any severe or persistent side effects while taking Zithromax. User experiences with Zithromax. To get a better understanding of what to expect with Zithromax, it can be helpful to hear from others who have used the medication. User experiences can provide valuable insights into the effectiveness and tolerability of Zithromax. Many users report positive experiences with Zithromax, noting that it effectively treated their infections and provided relief from symptoms. Some users have reported mild side effects such as nausea and diarrhea, but these were generally manageable and resolved on their own. It is important to note that everyone's experience with Zithromax may be different, and individual responses to the medication can vary. It is always recommended to consult with a healthcare professional for personalized advice and guidance. Precautions and contraindications for Zithromax. While Zithromax can be an effective medication for treating various infections, there are certain precautions and contraindications to be aware of. Zithromax should not be used by individuals who are allergic to azithromycin or any other macrolide antibiotics. It is important to inform your healthcare provider of any known allergies before starting treatment with Zithromax. Additionally, Zithromax may interact with other medications. It is important to disclose all medications you are currently taking, including over-the-counter drugs and supplements, to your healthcare provider to avoid potential drug interactions. Zithromax should be used with caution in individuals with certain medical conditions, such as liver or kidney disease, as dosage adjustments may be necessary. It is important to discuss your medical history with your healthcare provider before starting treatment with Zithromax. Alternatives to Zithromax. While Zithromax can be an effective treatment option for many infections, there are alternative antibiotics available for those who may have contraindications or allergies to Zithromax. Some alternative antibiotics that may be prescribed for similar conditions include amoxicillin, doxycycline, and ciprofloxacin. Your healthcare provider will determine the most appropriate alternative based on your specific situation. It is important to note that the choice of antibiotic will depend on factors such as the type of infection, the severity of symptoms, and individual factors. Your healthcare provider will guide you in selecting the most suitable treatment option. Discussing Zithromax with your healthcare provider. If you believe that Zithromax may be an appropriate treatment option for your condition, it is important to discuss it with your healthcare provider. They will be able to evaluate your symptoms, perform any necessary tests, and determine the most appropriate course of treatment. During your discussion with your healthcare provider, be sure to mention any allergies, medical conditions, or medications you are currently taking. This will help them make an informed decision about whether Zithromax is the right choice for you. Your healthcare provider will also provide you with detailed instructions on how to take Zithromax, including dosage, frequency, and duration of treatment. It is important to follow these instructions carefully and complete the full course of treatment to ensure the infection is fully resolved. Frequently asked questions about Zithromax. Can Zithromax be used to treat viral infections? No, Zithromax is an antibiotic and is only effective against bacterial infections. It will not work against viral infections such as the common cold or flu. Can I drink alcohol while taking Zithromax? It is generally recommended to avoid alcohol while taking Zithromax. Alcohol consumption can increase the risk of certain side effects and may interfere with the effectiveness of the medication. It is best to consult with your healthcare provider for specific guidance. Can Zithromax be used in children? Yes, Zithromax can be used in children for certain infections. However, the dosage and duration of treatment may be different compared to adults. It is important to consult with a pediatrician for appropriate dosing and guidance when using Zithromax in children. Can I stop taking Zithromax if I start feeling better? No, it is important to complete the full course of treatment as prescribed by your healthcare provider, even if you start feeling better. Stopping the medication prematurely can lead to incomplete eradication of the infection and potential relapse. Conclusion. Zithromax, or azithromycin, is a versatile antibiotic that can be used to treat a variety of bacterial infections. From respiratory tract infections to skin infections, sexually transmitted diseases, and ear infections, Zithromax can provide effective relief from symptoms and help speed up recovery. However, it is important to follow dosing guidelines and be aware of potential side effects. Always consult with a healthcare professional to determine the most appropriate treatment for your specific needs and discuss any questions or concerns you may have about Zithromax.